I'm presenting this work on behalf of Dr. Coleus, and he apologized because he cannot be in the session as he's chairing a parallel session which is running in the photoacoustic session in the VIP room. And if you have further questions, he is happy to answer your questions later when the talk is over. Our group is interested in studying the circulating tumor cells. And why are we interested about this topic? When tumors are growing in the body, they metastasize, and the process of metastasis is one of these tumor cells or some of these tumor cells are detached from the cancer site, and then they go into the bloodstream and they circulate all over the body. And the metastasis is responsible for 90% of the deaths from the cancer. These circulating tumor cells have different properties compared to the normal cells. They are bigger. They have a different Nucleus-to-Cytoplasmic Ratio. And detection of these circulating tumor cells will help in early detection of cancer, patient prognosis, and also treatment monitoring. So calculation of the Nucleus-to-Cytoplasmic Ratio is very simple. Simply it's by calculating the area, cross-sectional area of the nucleus and cross-sectional area of the cancer cell. However, to know this before, we need to be able to size and detect the nucleus and also the size of the cell. So, for example, here you can see a cancer cell with a very high Nucleus-to-Cytoplasmic Ratio and a normal cell with a very low Nucleus-to-Cytoplasmic Ratio. The process of identifying the size for the size of the cell and size of the nucleus is in two different methods. The first method uses ultrasound and get the backscatter from the cell, and through that we are able to estimate the size of the cell. And the second one is by using a contrast agent, which is DRAG5, and it's specific to the nucleus, and getting the photoacoustic signal from the nucleus and estimating the size of the nucleus. So when the ultrasound beam hits the cell, there's a backscatter signal from it. If you take the FFT of that, it's, the theoretical equation for the backscatter is given by this. If we plot the power spectrum of it versus the frequency, we will see that the power spectrum has lots of maxima and minima, and the distance between these maxima and minima are dependent on the cells, dependent on the radius of the object which is scattering the sound. For example, here the 20 micrometer scattered frequency spectrum has very narrow, these maxima and minima are very narrowly distributed, while for a smaller size object, they are wide. So the distance between these adjacent maxima and minima are smaller in case of larger diameter scatterers. The same type of equation also governs the scattering from a photoacoustic signal. From the nucleus, if we take the FFT of the backscatter signal from the nucleus of a photoacoustic signal, we will see again the maxima and minima in the power spectrum, and again the distance between the adjacent maxima and minima are dependent on the scatter size. We can simplify the previous equations, very complex equations that was shown in case of a fluidosphere, which has acoustic properties which are very similar to the surrounding medium. In this case, the ultrasound backscatter and also the photoacoustic emission can be approximated by a Bessel function of first kind. And through this, we are able to, by feeding the backscatter signal from the experiments into these two equations, we are able to find the scatter size for the cell radius and also the nucleus. The experimental setup to study the backscatter from the cells is consisted of a transducer with a center frequency of 375 megahertz and a bandwidth of 150 megahertz. The laser which irradiates the cells to get the photoacoustic signal is a 532 nanometer laser with 4 kilohertz repetition frequency, and the pulse width is 330 picoseconds. The cell lines that are studied in this work are MCF7 cells and HG29 cells, and the contrast agent which is used for the nucleus is DRAG5. Here, a sample result of the scattering from one single cell and ultrasound scanning from one single site is shown here. The normalized signal amplitude is shown as a function of time. If you take the power spectrum of it and look at the normalized power spectrum amplitude versus the frequency, we can have this graph. This is not as nice as the previous theoretical results because of the effect of transducer bandwidth. If we fit this to the theoretical formula, we will have this black line, and using this fitted value, we were able to calculate the radius, in this case, for the cell to be 7.59 micrometer. The same, the photoacoustic signal from the same cell is shown here as a function of normalized signal amplitude versus time. If you take the FFT of it, again, we will see the power spectrum as a function of the frequency, and if we fit this power spectrum to the theoretical value, we can get this black curve, and from this black curve and using the equations that was shown, we are able to calculate the radius of the nucleus. Now we have the radius of the nucleus and we have the radius of the cell, and using the equation for the nucleus-to-cytoplasmic ratio, we are able to find the nucleus-to-cytoplasmic ratio using this method. So here I'm showing the results of 29 HT cells. We calculated the nuclear radius, the cell radius, and a nucleus-to-cytoplasmic ratio, and they are similar to the values reported in the previous works. The values for the MCF7 cells are shown here. The nuclear radius are in very good agreement with the previous reported values, and the cell radius is also in very good agreement with the previously reported values, and the nucleus-to-cytoplasmic ratio is in good agreement with the acceptable value of 1.8. In the future, here in the previous work for the photoacoustic signal emission, we used a contrast agent that was DRAC5. The next step in this work is to use ultraviolet acoustic signal for label-free evaluation of the nuclear radius. In summary, ultrasound was used to determine the radius of HE29 and MCF7 breast cancer cells. Cell nuclei were stained, and photoacoustic signals were used to determine the nuclear radii. The nucleus-to-cytoplasmic ratio was calculated for each of these measured cells, and we are now investigating the label-free acquisition of nucleus-to-cytoplasmic ratio. Thank you.